we, the doctors in the North Rift, the consultants at the Moi Teaching and Referral Hospital, and the consultants and lecturers at the Moi University School of Medicine, wish to state as follows. Firstly, we are mortified that the government is willing to let people continue dying at the expense, just because they are unwilling to sit with the union to negotiate about the healthcare of Kenya. We want to note that we do not want this strike to continue. We want this strike to end today or yesterday if possible. The only way this strike is going to come to an end, ladies and gentlemen, is by the government coming down to the negotiation table and talking to the union about the 13 issues that they have raised about healthcare in Kenya. I want to note also that having gone through the proposal by the union, it is clear that this strike is not about salaries to the doctors alone. I have looked at the proposal, and the reason I am sitting here today is because I am convinced that the proposal is about improvement of healthcare services in this country. It deals with understaffing at public hospitals. It deals with poor working conditions, lack of medicine, lack of gloves, lack of care for health workers, not just doctors, but all health workers in Kenya. I would like to remind everybody that a poorly treated health worker is dangerous to the population of this country. And I think we're already seeing the effects. I want to also note that all the doctors who are on strike today took and subscribed to the Hippocratic Oath. And this has been repeated over and over by people who do not understand what the Hippocratic Oath says. The line of the Hippocratic Oath that is most compelling, that drives every doctor to wake up in the morning and go to the hospital to treat patients, says that the health of my patients shall be my first consideration. These doctors are out in the streets fighting for the health of their patients. The first consideration of these doctors is the health of their patients. And the reason they are on the streets is because they are tired of sitting and standing by in the hospitals and watching patients die from preventable causes. It is time that these issues are addressed. It is time that the government came down from its high horse and sat with the union and humbly went through the 13 items of the proposal and addressed each and every one of those items. And I challenge you, ladies and gentlemen of the press, every time the Assistant Minister for Medical Services speaks in public and talks about 10,000, 20,000, 30,000 shillings, ask him what they have agreed on the other 13 items in the proposal. This is not about money, it is about the health of our fathers, our mothers, our children, and the future generation. So we are asking the government to come down, to negotiate with the union, and to become reasonable in their response to this union. And in connection to that, therefore, we wish to state here openly that all the doctors in the North Rift region are with the union, and they support the action of the union. And the reason they support the action of the union is because if successful, then Kenya will be one of the leading countries as far as healthcare provision is concerned. And this is the vision that is expressed in our constitution, which gives you, ladies and gentlemen, the right to the highest attainable quality healthcare services in the country. Thank you.